Hi, welcome everyone. We are ahead of time, so we'll just take a couple of minutes for everybody to settle in and join. I can see a lot of people joining in ahead of time. Thank you so much. We'll wait for 3 to 4 minutes more, just so that everybody joins in, and then we start in time. So another 2 minutes, I believe, and then we start. I can see a couple of people still logging in, and we're accepting them to join in. So let's wait for another 1 or 2 minutes here. So another one
Hi,
minute.
Dr. Geeta.
Hi, Dr.
Hi,
Kiran.
Dr.
Hello.
Kiran. Hello, hello. Dr. Kiran, we're just settling in. We're just giving our audience 1 more minute to just join in, and then we will start.
Fair enough. Fair enough. Fair enough.
Thank you. Thank you. So we'll just allow one more minute and then we begin. Let's see, joining in. All right. I think we should begin. It's already 5 past ahead of time, and we can accept the attendees as and when they join. Okay. All right. So, good afternoon, everyone, and a warm welcome to all of you joining us today. My name is Ankit Saklani, and on behalf of Prospera Global, it is my privilege to be your host for this webinar. Before we dive in, I would like to extend a warm welcome to everyone joining us today. Colleagues from the insurance and TP industry, claims professionals, and individuals and families here to learn more about this important topic. It is wonderful to see how such a diverse audience come together from different geographies of the world for a topic as important as this one. And we are truly glad to have each one of you with us today. So let's talk about why we are here today. Cancer is talked about constantly but understood far too little. Between myths, fear, and misinformation, most people don't actually know what early detection looks like or what their options really are once a diagnosis comes in. And on the other side of that journey sits an equally important but often overlooked piece: how that diagnosis is documented, assessed, and approved for treatment. Today, we hope to bring clarity to both sides of the journey. Here's a simple truth: cancer doesn't just test body, it tests the system around it. The medical system that decides the treatment, and in most cases, the insurance system that decides access to it. Most conversations on cancer focus only on the first. However, today we are going to talk about both. That's why today's session unfolds into two parts. In first part, our esteemed guest speaker, Dr. Kiran, will walk us through the medical side, understanding cancer, prevention, early detection, and what a good treatment looks like. In the second part, Dr. Geeta will join the conversation and put a few important questions to Dr. Kiran from a claims and insurance perspective. Because at the end of the day, a timely diagnosis means little without timely approval. And that's the gap we are here to close today. So before we begin, let me quickly introduce our guest speaker for the session. We are extremely fortunate to have with us highly experienced and well qualified oncologist Dr. Kiran Shankar. Dr. Shankar is a consultant surgical oncologist at Kaveri Heart and Multi-Specialty Hospital in Mysuru, India, and brings with him over 15 years of experience, including international training abroad. He specializes in complex solid organ and gastrointestinal cancers and holds an impressive set of qualifications. Beyond the credentials, what truly stands out about Dr. Shankar is the balance he brings to his practice, combining surgical precision and clinical excellence with a deeply compassionate, patient first approach to care. Thank you so much, Dr. Shankar, for joining us today. We also have Dr. Geeta Sadana joining us today. She is the Director, Medical Claims, Audit and Training at Prospera Global. Dr. Geeta comes with more than 23 years of experience in the industry, with spending 14 years in the UAE insurance market. She is known for a calm, nurturing personality and her ability to make people feel supported and at ease. She brings clarity and structure to complex medical and insurance conversations. Always a pleasure to have you on board, Dr. Geeta. Thank you so much. I think that's about the introduction. So we'll begin the first part where Dr. Kiran will talk about and answer a few questions on his own. So the forum is all yours, Dr. Kiran. Thank you.
Thank you, Ankit. I am audible, right?
Yes, yes, you are audible, Dr. Given.
Yes. Thank you for the wonderful introduction. And I must um, Definitely, second, your opinion on Dr. Geeta. Definitely supportive and more so encouraging us to do something more always. Now, coming to the topic for discussion today, cancer. I'm sure all of us have heard about what is cancer and what are we doing for cancer and how does it occur. So let's just talk a little bit about cancer and try to understand the WH words of cancer. What is cancer? How does it occur? Why is it occurring? And why do we need to know about cancer? First of all, what is cancer? Yes, it is the disease of the hour. It is increasing. There are a number of cases which are picked up probably on a daily basis or on a weekly basis or an hourly basis. It depends on which geography you are located. It is a group of diseases where there is abnormal proliferation of cells. So, what happens normally in our body? Cells multiply in a very um, specific manner. One becomes two, two becomes four, four becomes 16, and that's how they multiply. Now, in case there is a break, and when there is a break in this multiplication, it leads to cancer. All breaks do not lead to cancer. There are some breaks which leads to what we call as precancerous diseases, but majority of them go into cancer. So that's when cells lose their power to multiply at a normal pace. One becomes five, five becomes 100, 100 becomes 1,000, and it goes on. And when this cancer multiplies to such an extent that the normal functioning of the body is at risk, the normal functioning of the body takes a backseat, and cancer multiplication becomes more important, and cancer multiplication takes the forefront. That's when the disease has taken an upper hand over the normal or over oneself. So this is in the nutshell of to what is cancer. It's a group of diseases where multiplication of cells has gone haywire and we do not have a control about what and how the cells are multiplying amongst themselves. Why does cancer occur? Now, I am a normal person. I have my proper 9 to 5 job. I have a very good family. But still, why did I get cancer, doctor? This is a very common question which I face in the outpatient clinic. There are many reasons as to why one develops cancer. I would, on a nutshell, I would classify them into two broad categories. One, reasons which are under our control, where if we had not done something, then we could have avoided cancer. These are called modifiable risk factors. And there is something called non-modifiable risk factors, where these are completely not in our control at all, but still we are more susceptible to develop cancer. The most important non-modifiable risk factor is age. All of us want to live. The longer we live, the more diseases we attract. This is the law of the land. Very rarely do we know of a person in his 60s, 70s, 80s who do not have any ailments. Fortunate are those who survive up till then without any ailments. Yes, non communicable diseases are increasing drastically more than communicable diseases. The most important non communicable disease is heart disease, next is cancer. Increasing age increases the risk of development of cancer. Next, just by virtue of being born as a female, we increase the risk of breast cancer. Just a small note, men also can develop breast cancer. The only problem is in men, we do not have functional breasts. Every word is important. We do not have functional breasts, but we have breasts. Women have an increased risk of ovarian cancer, cervical cancer, breast cancer, endometrial cancer because they have the organs, they have increased risk of developing that cancer. In men, there is a very high risk of developing lung cancer, oropharyngeal cancer, that's cancer of the mouth, inside organs, and of the oral tract, the tract which we use to consume food. Genetic causes. These are again not in our control at all. What genes we are made up of are thanks to our parents. These are again not in our control. Mom had an increased risk of developing breast cancer. Dad has some other risk, some other genes which are developed, which have an increased risk of developing cancer. They may not be cancer patients. They may just be cancer gene carriers. But when we are born, if that one gene carrier and this one gene carrier combine to form us, then we are at a very high risk of developing those particular types of cancers. So this is where genetics play a very important role. That's why we try to find out if our parents or the patient's parents or first degree relatives, an elder brother, an elder sister, maternal aunt, maternal uncle, paternal aunt, paternal uncle, grandparents had cancer, then it increases the risk of one developing cancer. These are some of the non modifiable risk factors. Modifiable risk factors. I'm sure all of us are known, all of us know about it, the so called lifestyle changes or lifestyle disorders. What are they? Smoking, any form of tobacco smoking, any form of tobacco consumption is an increased risk of developing cancer. This can be upfront smoking, which means I'm smoking, I have a risk of developing cancer. Secondhand smoking, I am smoking, my wife, who is not a smoker, or my parents who are not a smoker, still have a very high risk of developing cancer because they are breathing the same air which I breathe out. This is called second-hand smoking. What is third-hand smoking? Third-hand smoking is I smoke, I finish my smoke in the room and go out. Now, with your permission, Dr. Geeta comes into the same room for her work, but she has to breathe the same air. Yes, she is also at a risk of developing cancer. This is called third hand smoking. Any form of tobacco smoke or tobacco consumption increases the risk of cancer. Along with that, there is, I'm not quite too sure if it is rampant in that part of the world, but whereas in India, tobacco is being consumed along with betel nuts, along with pan, along with quid, or it is kept inside the mouth for a very long period of time. It acts as a local irritant. This itself increases the risk of developing cancer of the oral cavity. Alcohol consumption. No form of alcohol consumption is safe. Again, increases risk of cancer. Obesity. Obesity, I'm sure all of us know, is the next pandemic. There are a lot of people who consume saturated fats, processed food. All these increases the fat stored in the body. This increases the risk of developing cancer. A lifestyle which has reduced physical activity, increased sedentary lifestyle, yes, increased risk of cancer. Exposure to some industrial chemicals or infections, HPV infections, hepatitis infections, Epstein-Barr virus infections. All these are avoidable causes of cancer. So these all come as modifiable causes of cancer. So this is in a nutshell as why does cancer occur? It could be the reasons could be some which are modifiable, which are predominantly lifestyle oriented, others which are non modifiable, which we have no control over. So basically, my dictum and the way I counsel my patients is let's try to have a control over stuff which can be controlled, which are possible to be controlled in our hands. There is no point of crying over something. I'm born as a female, my genes are bad. There is nothing that you can do about it. But yes, I could stop smoking. I could lead a very healthy lifestyle. I could reduce consumption of alcohol to becoming a teetotaler. Yes, I may stand out as a social stigma in today's world if somebody says I'm a teetotaler and I don't smoke, but that's okay because if I have good health, everything else falls into place. There are some infections like HPV, hepatitis. Fortunately, we are in the world in which there is vaccines associated with these infections. So I would definitely recommend women above the age of 10 to 12 years to get yourself vaccinated against the HPV virus. It could definitely prevent one developing HPV infection, which could lead to chronic cervicitis, later on progressing to carcinoma of the cervix. Among the men too, please take the HPV virus vaccine because it could prevent a whole lot of infections which could later be precancerous or cancerous lesions later on in life. This is in a nutshell of why does cancer occur. Specifics like skin cancer, chronic exposure to sun, because there is an element of UV rays. That's why it's advised to apply sunscreen with a very high SPF, sun protection factor, so that it prevents direct the sunlight coming in contact with the skin. The warning symptoms, yes. Again, this depends on what type of cancer we are looking at. There could be symptoms associated with cancer in the oral cavity, the breast, in the gastrointestinal system, in the hepatobiliary system, in the respiratory system. So let's go one by one. The early symptoms, probably in the oral cavity and the head and neck region, is uh, presence of an ulcer which is not healing despite taking regular medication. And what regular medication does one resort to? Either a painkiller or a gel or some soothing agents, or sometimes we prescribe the lozenges. Despite taking all of these, the ulcers in the mouth usually stay on or increase in size for a period of at least 3 to 4 weeks. It could be cancer. Get yourself checked by a dentist, otorhinolaryngologist, or approach us. We would definitely not miss cancer because cancer diagnosed at this stage is very early, which means cure is possible at that. I do not want anybody to miss this stage. Any recent change in the history of change in voice, difficulty in swallowing, difficulty in eating. I have chewed my food very well, but I am unable to swallow. Once I swallow, uh, there is a sensation of food getting stuck in the throat and blood in the vomitus. I consume my diet very well. I swallow, but within half an hour, the entire food comes out with force. I throw up quite a lot of food. Problem, jaundice, increasing jaundice to such an extent that I get itchy throughout the body. Regular menses, regular periods in women usually last for 3 to 4 days. A very high menstrual flow, intermenstrual bleed, in between the menses if you're having a lot of bleeding, postcoital bleeding after having a sexual intercourse, if there is bleeding or if there is pain during sexual intercourse. There is a difference between pain and pleasure. You need to identify what is pain to think or suspect that it could be cancer. Breast, most commonest symptom is a painless lump in the breast. Any painless lump in the breast needs to be evaluated. Not all painless lumps are cancer, but all should not be avoided. Sometimes we have a variant called lobular carcinoma, which presents only as a 2 or 3 centimeter lump, only on investigation to find out it's already spread throughout the entire part of the body. These are aggressive forms of tumors. Any changes in the skin, all of us have moles in the skin. We are born with the moles. We call it as a birthmark, or in our local terms, there are a lot of terms. A changing characteristics of these marks, increasing size of the mark, increasing color of the mark, or the mole is increasing in size, doubling in size. All these could be symptoms of cancer. Any lump in the body, especially the painless lumps, should never be neglected. Pain, if present, usually signifies an advanced disease. However, there could be associated infection which could give rise to the pain. On a broad spectrum, on a broad terminology, um, loss of weight, loss of appetite. I'm able to eat well, but I'm not putting on weight. All these are symptoms of cachexia, usually signify an advanced cancer. Chronic cough, chest pain, breathlessness could also be symptoms of cancer, one lung or cancer somewhere else in the body, which is spread to the lung and causing these symptoms. So, again, on a broad spectrum, change in voice, lumps in the neck, especially in the front of the neck or the lateral part of the neck, changes in our bowel and uh, bladder habits, passing excessive blood in the menses, in motion. All these are symptoms of cancer. Please do not neglect them. Even if there is a doubt or you think it could be cancer, you may be wrong. It's okay to err on the wrong side. In this case, err on the right side because it's better to get yourself investigated and find out that you do not have cancer rather than sit on it and come back to us with stage 3 or stage 4 cancer where cure is not possible and we just have to learn to live with it. To never miss early symptoms of cancer because that's when cure could be achieved and we are aiming to achieve cure in patients with cancer. Yeah, like I said, once we have a patient with these symptoms of cancer, then we go to the surgeon, the gynecologist, or an oncologist, and after a detailed examination, a detailed history, then we examine the patient. Examination essentially entails finding out what the symptoms were, trying to pick up signs which we could entail or find out on examining the patient, following which we do some basic investigations to find out if cancer is present or not. Upon the diagnosis of cancer, then we stage the disease. So, when do we suspect cancer? Presence of any one of those symptoms which I have already enlisted, definitely meet an oncologist to find out whether cancer is present or not.
Mm. Okay.
Okay, this is a difficult one. How do I prevent cancer? See, I told you about the how is cancer caused, and Rani, Ashwari, I told you about how is cancer caused. So we have the modifiable risk factors and the non-modifiable risk factors.
Mhm.
So obviously, I'm sure all of us know the non-modifiable risk factors cannot be modified, and that's why they are there. So we don't discuss them.
Mm.
Prevent cancer, lead a healthy lifestyle. There is no trying to avoid smoking. Avoid smoking. It just gives you a high and nothing but it. There is not one advantage of smoking. It may be difficult. Yes, I understand. It is possible. So avoid smoking. Lead a very healthy lifestyle. I'm sure all of us in whichever work domain we are working have an element of stress. Yes, life comes with stress, but there is a way to handle it and there's a way out always. So learn how to handle it. And tobacco is not the answer to stress. Alcohol cannot be the answer to stress because tobacco and alcohol just give you high or take you high for probably a few minutes to a few hours. Then you're back to ground zero where you have to face the world. A healthy lifestyle. Try avoiding a sedentary lifestyle. A more active, a minimum of 30 to 45 minutes of brisk walking is basic that you can do to yourself. Most importantly, all women and men above the age of 40 years or 10 years younger than the youngest patient in your family with cancer. Slightly complicated, I'll tell again. All men and women above the age of 40 years I assume the men and women above the age of 40 years do not have a family history of cancer, which means no papa, no mama, no dada, dadi, nobody have cancer. This is one set. The other set is all men and women 10 years younger than the youngest member in the family with cancer. Mom got cancer at 40, which means from 30 years. 10 years younger means from 30 years, I will start investigating the possibility whether I can get cancer or not. This is called screening. Please get yourself screened. This is the best birthday gift you can gift yourself. No Rado, no Rolex. I don't know the other brands. Can it will just give you 5 minutes of pleasure. But the report which says pap smear negative, mammograph zero, fecal occult blood negative, that piece is something else. You will understand it only when pap smear becomes positive. Don't allow yourself to get women above the age of 40 years every year. Please get a yearly screening mammogram. It's a basic 5-minute X-ray of both the breasts. Women younger than 40 years, usually we do not recommend a mammogram. Get a sonomammogram, get an ultrasound of the breast, that is enough. Get a pap smear done on a yearly basis. Otherwise, once in 3 years, get a HPV DNA testing done. That is good enough. Men above the age of 40 to 45 years, please get yearly fecal occult blood test done to check whether there is blood in the stools. Women can also get it done. Men who are at a high risk of smoking, who have smoked some point of their time, can get a low dose CT scan of the chest to find out early stages of lung cancer. Men above the age of 60, 65, usually the ones who have urinary problems, difficulty in urine, difficulty in passing urine, dribbling of urine, nocturia. I get up, the patient gets up minimum of 4 or 5 times, goes to the urine at night. There is a sense of incomplete voiding. Please get a blood test done to find out if the prostate is enlarged or not. These are the 5 basic screen detected cancers. They can detect cancer at an early stage and help you lead a very healthy life. Besides this, good lifestyle, avoid a sedentary lifestyle, lead a more active lifestyle, avoid red meat. I know it is difficult, but you can reduce your consumption of red meat, increase your consumption of food which is rich in antioxidants, vegetarian diet. I think this should help you sail through. Yeah, I think I've answered most of that in the previous one.
Yes, yes, yes,
Lead a good, healthy lifestyle. Yes,
yes, yes.
I mean, at least in my family, my family says if given an opportunity, I would probably be the brand ambassador of Pizza Hut because I love it. That doesn't mean lunch, breakfast, and dinner can be Pizza Hut. No, it cannot be. So you have your days, you have your birthday, you have an event. That's okay. There's always a cheat day. Even in the gym, there is a cheat day. So that's okay. Um, yes, it is known red meat causes colorectal cancer, but yes, the world will not stop consuming red meat. You reduce your consumption of red meat. These are the small changes that you can do. Reduce smoked meat. You boil the food. Don't grill it. Don't um, oven it. Boil the food. So these are small changes which one can definitely incorporate in your lifestyle to reduce your risk of cancer. This is what we could do on a daily basis. The food which is going to be heated and given is much better than the food which is put into the oven and given to you to eat versus the food which is grilled. I'm sure, I don't know how many men actually get into the kitchen, but I'm sure the women do get into the kitchen. I'm not trying to be gender biased or anything like that. I'm just saying the cultural norm back here in India. But I'm sure Dr. Geeta also will agree.
Yeah, yes,
What a
100%.
lot of my patients what a lot of my patients tell me is, this is in Kannada. I will translate it. Sir, ನಮ್ಮ ತಾತ ಅಜ್ಜಿ ತಿಂದ ಊಟ ತಿಂದ್ರೆ ಸರಿಗಿರ್ತೀವ, which means the food, the diet which our grandparents used to eat is the best diet. Out of great difficulty, uh, I'll on a more lighter note, all of us have started what is it? Intermittent fasting. How many of us do intermittent fasting? And how many of us fail at intermittent fasting? Okay. If you go back to your grandparents, or I mean,
Mm,
depending on what age you are in, your parents or grandparents, whatever, every month there was Ekadashi Upvas.
correct. Yes, yeah.
That is nothing but that is
Mm,
nothing but what do we do now? Intermittent fasting.
yeah,
And they used to do, it was only a 2 meal day for them.
yeah.
Even now we have made it 3 meals for our luxury. Otherwise, when once the grandfather or the person who earns the money for the house comes back home, they all sit across, have food, and the kitchen is closed. 6 o'clock, 10 o'clock, kitchen is closed,
Mm,
and that is a very very healthy lifestyle. Unfortunately, we are not following that for reasons best known to us, and yeah, we are trying to get back to that when we actually knew what was happening.
correct, correct.
What,
Yes,
what is
thank
more
you.
surprising is yoga started in India.
Mhm.
Yoga started in India. I'm sure all of us know about it. Nobody practiced it. Now, the maximum number of yoga teachers or foreigners in India teaching Indians yoga. So we all know about it, because if we go back to history, that is BC and well beyond that, the father of surgery is Sushruta, who's an Indian. In fact, 2 days ago, I don't know if you're well versed with what's happening in the world, in the Royal College of Surgeons, his bust was unveiled, only to know that it was Sushruta, who is the father of surgery.
Mm,
So basically, when one says we're going back to our roots, one actually means we're going back.
correct.
So that's how it is.
Yeah. Thank you. Thank you so much, Dr. Kiran, for such an insightful and highly informative session. It was really good to hear all that from you. Though, yes, you are very right. We are going back to intermittent fasting, and it is something in legacy of what we have learned from our ancestors about the Akashi and everything. But it was so good coming from an oncosurgeon. So yes, you have actually explained everything so well, like what is cancer and how it develops, early warning signs, which I'm sure are really going to help everyone, the entire audience, what we have over here today. So now, building on this foundation, and because many of us are in claims management, we are doctors working in health insurance industry, I will shift this particular discussion from general audience towards a little bit of doctor side related to the insurance perspective. So that, of course,
Fair
it can
enough.
help us. Yeah. So as I've told you, in our roles as a pre-authorization and claims professionals, we basically are a link between the treating doctor, the patient, and the insurer. And we are responsible for, reviewing medical records, whatever we get from the hospital. We understand the plan of management, what they send to us. And of course, we make sure, that evidence-based medically necessary treatment only is approved. But still, we are sometimes in a dilemma that is it really cost effective and actually very effective and, like as per the international guidelines or not. So keeping that perspective in mind, I will be asking few questions from you now. Okay, so first of all, Dr. Kiran, we would like to know from you what are the key clinical documents and findings that confirm that the patient is having a cancer. And once it is confirmed, we all know that it has got some kind of staging and grading. So we want to understand how this particular staging and grading it influences the treatment. See, basically, why I'm asking this is because many a times we know. Like for some cancers, only surgery is sufficient and the patient doesn't need any kind of chemo or radio. Sometimes it can be only two modalities like surgery and chemo or radiotherapy. So we would like to understand this from you so that it becomes easy for us to evaluate a case.
Fair enough. Fantastic. Let me start off. Cancers are of two types: solid tumors and liquid tumors.
Mhm.
Liquid tumors are lymphomas and leukemias, that is blood cancer, and various forms of blood cancer. Blood cancer, 99% it is chemotherapy. It is done, identified by blood, drawing blood and seeing it, reviewing the blood picture in the microscope. Now, coming to solid tumors, you need a biopsy to confirm the presence or absence of cancer. A biopsy is bare minimum which is required. Initially, it was FNAC. Yes, FNAC is still done now, but the amount of information we get from a biopsy, unless indicated, cannot be got from an FNAC. So I would definitely want a biopsy to confirm the presence of cancer. However, not all cancers require a biopsy.
Okay.
Suspected thyroid malignancy, FNAC is good enough.
Okay. All right. Yeah.
Suspected ovarian cancer, no ovaries, if it is not spread, then we should not puncture the ovary because we are upstaging the disease. What is stage 1 becomes stage 2, stage 3, stage 4. No, we don't. Direct surgery. Without a diagnosis, yes, ovary, we go ahead. So we cannot generalize it. But predominantly, a biopsy is done. The biopsy tells us cancer is present or not present. If cancer is, let's assume cancer is not present, then the discussion ends. We don't talk more about it.
Mhm.
If cancer is present, what is the type of cancer? Has the cancer spread to the adjacent parts or not? What we call as lymphovascular invasion is present or not? Perineural invasion is present or not? Most important, grade, what you told me, grade. Grade will tell us how aggressive the tumor is. Now there is one cell, one becomes two. Going back to what I said, one becomes two, two becomes four, four divides becomes eight, eight becomes 16, and that's how it goes on. In cancer, this algorithm is lost. So multiplication occurs at a faster rate. Grade 1 cancers usually replicate normal cells, whereas grade 3 and poorly differentiated cancers are on the other extreme of the spectrum. So, based on aggressive potential only, grade 1 is least aggressive, grade 4 is maximally aggressive, most aggressive. So, that is why grade is important. This is the grade of the tumor.
Okay.
Next, stage. Now we know it is cancer of any organ. Now we have to find out whether cancer of that organ has spread to other parts of the body or not. There are various investigations to find out. The best usually done recommended investigation is a PET CT because it will avoid the ambiguity of multiple CTs of the abdomen, pelvis, limbs, thorax, breast, head and neck. One PET CT we do, then everything is solved. Sometimes, in specific cases, we do specific scans. If it's prostate, we do PSMA PET CT. If it's neuroendocrine tumor, we do a Dotonac scan. So, depending on the type of tumor we have, scans can be regulated and changed. So, grading will tell us how aggressive the tumor is. Stage will tell us where all the tumor has gone. The two are not the same, they are different, and most important.
And the modalities that I was asking from you, like as far as like, do you think all three modalities are required in all the cancer types, or like how does you come to know that
Okay,
only
okay.
surgery would suffice? Yeah.
So basically, after the cancer is diagnosed and after it is staged,
Yeah.
Each cancer patient goes through an MDT. There is a multi-tumor disciplinary board where we discuss the symptoms of the patient, and both the surgical oncologist, radiation oncologist, medical oncologist. This is the core team for oncology.
Okay.
They will decide what is best for the patient. It is very difficult to give a blanket statement for this cancer, we
Yes.
should do this. It's very difficult
Mhm. Mhm.
because with so much of technology coming in, so many newer drugs coming in,
Mhm.
there is always a permutation combination of either minimum two modalities. Very rarely we have cancers of the thyroid, cancers
Mhm.
of kidney, localized, thyroid, however big they are, surgery only modality for cure. Kidney, if you can remove it, best modality for cure.
Mhm.
Ovary, early stage ovary, you can remove it, best modality of cure, surgery.
Okay. Mhm.
Whereas most of the others will require minimum two. One is chemotherapy, other
Or
one can be either
radiation.
surgery or radiation. The surgery and radiation both are local forms of treatment. We can't operate
Mhm.
on the entire body. We can remove the tumor from the body. We can't remove the body from the tumor. Radiation we can give only to certain parts. Only very rarely in lymphomas we do whole body radiation, but very unlikely, or in leukemias. Whereas chemotherapy is systemic, the entire body goes through it. We can't give it to a localized parts. There are some advances now coming up like HIPEC and HITOP where chemotherapy is given only to some parts of the body, but these are always exceptions.
Okay. Okay. Dr.
So
Kiran,
basically,
now,
once we yeah,
yeah, please carry on. Yeah.
so once the patient goes through the multi disciplinary board, algorithm is assigned to him.
Mm.
Like I'll give you an example. There is a patient with cancer of the breast.
Mhm.
It has come out as triple negative breast cancer,
Mhm.
small T2N0M0. First
Mhm.
scenario, patient wants to preserve the breast. Second scenario, patient doesn't want to preserve the breast. Irrespective of what the patient wants, first we do chemotherapy because it's triple negative breast disease. We do chemotherapy, reduce the size of the breast, reduce the size of the tumor, I'm sorry, and then we operate based on what the patient requires. If she wants to conserve, depending on the breast tumor ratio, we can either offer conservation, or if they don't want to conserve, we can remove the breast and with or without reconstruction.
Correct. Yeah.
Reconstruction here is not mandatory for cancer. Reconstruction is for cosmosis.
Mm.
So that's where you people can interfere and say, reconstruction, we are doing it for a cancer patient because the patient wishes to have a reconstruction. It is not
Mm.
mandatory.
But yeah.
But if we are doing breast conserving surgery, or if we are doing breast conserving surgery and there is discrepancy in the size of the breast, then we have to reconstruct the breast. That becomes
Mm.
mandatory, depending on what the patient wants. Same patient, same
Mhm.
case, if it is ER positive,
Mhm.
HER2 negative, then we can offer surgery first. So that is based on the biopsy. So that's why biopsy is important.
Mm.
And again, the biopsy determines what we are going to do and the results of the biopsy. So you're not wrong in telling I did surgery for breast cancer. You're not wrong in telling I gave chemotherapy for breast cancer. So we need to know
Mhm.
what grade it was, what was the immunohistochemistry.
Okay.
That's how it is.
Thank you so much, Dr. Kiran. And okay, now as far as the PET CT is concerned, we all know that PET basically is done in all the cancer patients to see, of course, like metabolically active areas if the metastasis has occurred or not. But we have seen that, when a patient is undergoing chemotherapy, sometimes after each chemotherapy, some doctors they require a PET scan. Sometimes it is
No,
after two
no,
sessions.
no,
Like, yeah. So
no,
what is the correct
no,
thing?
no.
Yeah. Mhm.
Ideally, mid-cycle patient requires 8 cycles of chemotherapy.
Okay. Yeah.
Then after 4, we assess. Again, after 8,
Okay.
we assess.
Okay. So it
Definitely,
should be.
patient becomes definitely, again, there is a conditions apply for this. Say
Mhm.
after the first cycle, patient becomes symptomatic for some other reason.
Okay.
It could be cancer.
Mhm.
To find out, yes, we have to do. As a regular routine, not indicated.
Okay. So it's a symptom. In case if some new symptoms related to cancer develop, then it is justified. Otherwise, it's not required. Okay.
Not required.
Okay. Okay. And Dr. Kiran, as we all know that these days there is so much of advancement in the medications, and nowadays targeted therapies and immunotherapies are a lot in use. So we would like to understand the difference between the two therapies and if these are actually medically necessary or we can still follow the conventional treatment.
Okay. How many of us have a garden at home? A small garden. I don't know if it's
We
common
have
in
got
Dubai
only
or
the
not, but
pot.
we have a.
It's not a garden. We have got only flower
It's a
pots.
pot.
The plants.
Pot.
That's it. Yeah.
Plants. Okay, okay, okay. So we have plants, and let's assume we don't take care of the plants. We get weeds. Correct?
Yeah.
Unnecessary plants which grow in between them. Okay. So we'll keep this as the basic model. Okay. When we give drugs, the aim is to take off the weed. The aim here is to take off the weed. Okay. When we give chemotherapy,
Mm-hmm.
the weeds go, normal plant also goes.
Yeah. Okay.
That's why we have
Understood.
hair loss.
Mm-hmm.
That's why we have um, altered taste. That's why we have fatigue. That's why we have a lot of problems associated with chemotherapy.
Mm.
Okay. This is normal chemotherapy, conventional chemotherapy.
Okay. Yeah.
Okay.
Yeah.
Now, what is targeted therapy? Targeted therapy is anti-weed therapy. So, we are trying to identify mutations in the cancer and
Mm-hmm.
use drug directed only towards these mutations. So, the tendency of normal plants getting affected is very less.
Mm.
This is targeted therapy.
Okay.
Okay. What is immunotherapy? Immunotherapy doesn't disturb the plants at all. It will improve the nutrition in the soil so that only the plants survive and the weeds die. So immunotherapy increases our immunity.
Mm.
So the NK cells target and kill the cancer cells. That's it.
You
This
have
is the
explained it so beautifully, and so simple. Like it is something as if this question is
difference.
making no sense now. Yeah. Okay. Now, one more thing, because we all know these drugs are really, really expensive. So, do we have, because these are patent drugs, because majority is a new advancement and these are still patent. So, are there more generics or any kind of biosimilars that can be used instead so that, it becomes a cost effective treatment? And of course, member doesn't have to pay out of pocket because we all know in insurance, there's a limit, it's capped, and you cannot pay beyond that limit.
So basically what happens is there are generics which are coming into the market, but whether the
Mm-hmm.
generics is available in that part of the country or not has to be decided by you people or the doctor there.
Mm-hmm.
If it's the latest drug which is just recently launched, obviously we don't have generics. We have to go by the standard traditional molecule. Just to give you
Okay.
an example, trastuzumab, when it was launched, it was almost close to 2.5 to 3 lakhs. Trastuzumab. I'm sure all of you have
Yeah.
heard of it.
Yes. 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 Right.
Now, the
Okay.
same trastuzumab, which is 5 years old, 5 to 6 years old, is available
Mm-hmm.
for 10,000. Means road pe milta hai. It's going to take time until we come down to that level.
Mm-hmm. Okay. All right. Okay. Thank you so much, Dr. Kiran, for this, incredibly insightful session. And over to you, Ankit, for the conclusion and question and answer session now.
Thank you, Dr. Geeta, and thank you, Dr. Kiran, for explaining all the questions so logically and so easily to grasp. Okay, so the forum is now open for the audience as well. I can already see a couple of questions being asked, Dr. Kiran. So we are just taking few of the questions. We still have some time, so maybe they have some questions to ask for. So I have a quick question here from Sushmita Singh. She says, "Is cancer always hereditary, or it can it happen even with no family history at all.
Yes, it can happen with no family history. That's when we call ourselves or the patient as the index case. So yes, family history may or may not be present. Um,
All right. Okay, okay. Another one, it says, Dr. Kiran, with so much information on adverse effects of sugar consumption, and also since we work all in a corporate lifestyle, which we stay indoors, seated for 9 to 10 hours, could you please let us know its effects on cancer causing, and can this be avoided?
okay, let me get this straight. You want to know about sugar and cancer, right?
Yes, and also the fact that in a corporate lifestyle, we are just sitting and probably, drinking junk food, junk drinks and junk food eating, and also sitting indoor for quite some time, no movement, no activity. So I think the
Honestly, tell me,
quality
Ankit.
just drops.
Ankit,
Yeah.
between you and me, honestly, uh, how, sorry, I had to corner you.
Yeah.
How often have you opted for a tender coconut instead of a Coke?
I am actually, I don't know if it will, can you see this? Oh no, I can't actually. I'm having a coconut water actually, but it's packed. It's not natural. It's not organic. Yeah. Yeah. It's a packed. It's a
So,
packed one. Yeah.
so that's the answer. And
Yeah.
uh, um, when Dr. Geeta, the boss is here, Ankit is here. I'm sure all of us, if you're doing a 9 to 5 job, your work will not want you to be 9 to 5. I'm not trying to take you off your desk, but
Yeah.
I'm sure you can put in a 10-minute walk or simple,
Yes,
use the
correct. Yes.
elevator.
Of course.
True. Yes,
Of
Use
that's
the
course.
true.
elevator. Why do you want to use the stair? I mean, the lift. I mean,
Lifts.
don't use
Yeah.
the elevator, use the stairs. And you have to go in for a team outing or something, then obviously, if you're going for a mall for a lunch and that is like a mile or two off, walk. Nothing is going to happen. Nothing is going to happen.
Right. Right.
Consume
Thank
homemade
you.
food.
Actually,
Right.
I've seen Dr. Kiran, and he's so much involved in all marathons and everything. If you look at
So
him, the
that's
way he
a
is,
recent development.
yes. So I think we should all follow your steps and at least be a little bit active in on in our daily lives. Though we are not, to be
No,
honest, I'm not, but I think yes,
as
we
I
should
said,
be because
no, as I said, a 30 to 45 minutes of activity.
yeah,
That
yeah,
activity can be plain, simple gym, treadmill. Worst thing, you are staying in the fourth floor, fifth floor, 10th floor. Get down, go up twice. Enough. Enough. Nothing will happen.
Right.
It's
Okay.
better
I
if
have
something
another.
happens now rather than later.
Yes, Dr. Green. Yes. I have another pretty long question from Dr. John Sain. I'll just read out to you and you can answer it. As someone working in international medical assistance and IPMI, I have often found oncology cases among the most complex to manage, of course, because treatment pathways can become extremely prolonged, highly specialized, and very costly. Looking ahead, how do you see insurers? Sorry, I think I lost it. Yeah, looking ahead, how do you see insurers balancing the desire to provide increasingly comprehensive cancer coverage with the need for long-term sustainability? I'll just stop there because it's a long question. So probably if you can answer, or probably Dr. Geeta also you can pitch in. Uh, so basically, it just says that since the cancer treatments are, very costly and complex, how do you see insurance balancing the desire to provide a comprehensive cancer coverage with the need for long-term sustainability?
Okay, see, I'll tell you something. Very off the record, you cannot quote me, but there is always a treatment for cancer at any stage. One, the treating doctor should be ready to treat. Two, patient should be fit enough to take the treatment. In
mm,
today's world, fit enough means not patient being fit. Patient should be medically, socially, financially fit to
mm,
take the treatment. There is treatment. Okay.
Mhm.
Yes, treatment comes with its own share of complications, its own share of adverse effects. Everything will be explained to you by your treating doctor. From what I understand is you want to know whether this particular treatment is correct or wrong. Just to give you another example, there is something called the NCCN guidelines. These guidelines is universally followed throughout the world. In the US of A, this guidelines is done predominantly only for the insurance people, just to find out whether what prescription I give to the patient, which then comes to you, is it correct, legitimate, or not? That's all. All the protocols are there on the internet. NCCN guidelines. Dr. Geeta, just remind me, I'll send you a link also. You can circulate it.
Thank you. Yes, sure. Thank you. Thank you so much for that.
It comes as an app. So it adds to your sedentary lifestyle. It's all there on the click.
Okay. All right. And
It's
I
on the
think
app.
because, yeah. Okay. And they want to know
Every
about
day there
this.
is.
Yeah. There's one more question to this, that if the screening, if it is done, does it really help in detection? And therefore, of course, like we have to follow a list of, let's say, surgery, radio, and all that. But if we detect it at a very early stage because of screening, so does it really help in curtailing the treatment or making the cost
Definitely.
lesser as far as the insurance, we're talking from the insurance perspective now?
100%. 100%. Let's assume we have done a screen detected breast. It is usually stage 0 or stage 1, which means we can get away with surgery and close the treatment.
Yeah.
Okay. So, there is no chemo, there is no radiation. Close. Again, it differs from case to case. Assuming the patient comes in invasive breast cancer and patient wants to preserve the breast, then we have to add radiation. We can discuss on. But early stage, definitely, the way I counsel my patients on screening, you have an opportunity to tell, I had cancer, now I don't have cancer. Whereas when you become symptomatic, it's always I have cancer.
Yes. Yeah.
It's a big difference. Big difference.
Yeah. So, do you suggest that insurance companies should actually inbuild this particular benefit in the schemes, or the corporates should buy this benefit of screening, because ultimately it is going to help their portfolio?
Definitely. Screening will definitely help. One, your numbers will increase.
Yeah. Okay.
Because if it is covered, it will increase.
Yeah. All right. I think this answers Dr. Johnson's questions, because that is what he wanted to know. Okay. So now the next question, Ankit.
Right. Yes, I'll take another one. Can mutations occur in anyone or only passed on in the family?
It can be.
Can be anyone.
My parents did not have cancer. I am a
Yeah.
chronic smoker. I consume tobacco. Yes, mutations can occur.
Right, right. I think there is one more from Dr. Johnson. I can just break down how do you see insurers approaching coverage decisions for immunotherapy in future, particularly as more indications emerge and costs continue to rise?
When we started off, immunotherapy was used only for stage 4 disease. Now it has come for stage 2, stage 3, and stage 1 disease. Yes, immunotherapy is the way forward. But to know whether this is the correct immunotherapy or not, NCCN has the answer to everything. We are always there to help you out. Yeah, immunotherapy is the way forward.
Great, great, great. Thank you. And Dr. John is writing a couple of questions. Thank you so much, Dr. John. I think they're very relevant also. Just one more I'll take from him, because I'll just give one more question to another audience. Do you envisage broader coverage based on demonstrated clinical benefit, or more selective approaches based on biomarkers, outcome data, and cost effectiveness considerations?
I assume he's talking on targeted therapy. So, but if it is targeted therapy, I just cannot give targeted therapy to anybody and everybody.
Right.
I need to know what the target is. As we went back, targeted therapy is target against the weed. So I need to know what are the mutations present in the weed, and do we have anti-weed drugs? If we have those particular anti-weed drugs, then it is recommended to the particular patient.
Okay. Okay. Perfect. And one is another Dr. Sakshi is asking, what are some early warning signs of cancer that people often tend to ignore or mistake for something minor? I think you initially spoke about it, but I mean, very important ones maybe.
Basic ones: breast, a painless lump in the breast.
Right.
Problems with missing blood in the stools, motion, alteration in bowel habits. I consume street food on a daily basis. So if I develop some loose stools, diarrhea, for some time it's okay. But that is persisting for 2 to 3 weeks, then there's a problem.
All right. All right.
Okay,
Okay. I think,
one
yeah, yes,
second, one
Dr.
question from my side now. Dr.
Yeah.
Kiran, what happens many a times these symptoms, I've seen the doctors basically, if you have got this history of pain abdomen or let's say altered bowel habit, we immediately get a request for colonoscopy and gastroscopy. When we ask about alarm features, what is mentioned in NCCN and all those, sometimes the doctors, they, I should not say, but because I understand they have to be they have to rule out cancer first of all, so they are not listening to that and they basically specify that yes, this has to be done so that we rule it out, it has to be ruled out.
Okay.
And yeah.
First episode of alteration in bowel and bladder. I will not do any scopy.
Mm.
This is persisting for 3 to 4 weeks. Yes, scopy.
Yeah. And what about
Perfect.
any age? Because you had mentioned about age as well. So does age
See,
also play
see,
a role in these
assuming
symptoms?
definitely the higher the age, the chance of developing cancer is much higher.
Okay. All right.
There is no cutoff as such,
All right.
but I would definitely not look for gastric cancer in a 20, 30-year-old guy. That does not mean they cannot get it.
Hmm.
That is the double-edged sword we have to balance.
All right. All right.
Okay.
I also have a very small question since Dr. Geeta is also asking some. So, Dr. Kiran, my father was diagnosed with small cell carcinoma, and it was a stage 3. And he was a frequent smoker because we researched about it that time. And so, my question is, so if I talk about myself, I don't smoke. I'm a non-smoker. So apart from the general risk of having the cancer beat anybody, would I still be associated with that risk of my father's
What
cancer
at
because he
what
was a
age did
smoker?
you at what age did
Uh,
he develop cancer?
he was 60.
So that
60. Yeah.
that does not qualify as one small cell cancer because of smoking known factor. So that is okay. Assuming your mother is there,
Yeah.
assuming you have stayed with your father together, and
Yes.
there is a chance that
Yes.
you would have inhaled that smoke. So there
Right.
is a possibility of second hand or third hand smoking. But if the hiatus of no smoke period is quite a bit, then we could put you on a follow up. There's no harm in doing a low dose CT scan to identify if there are any lung lesions present or lesions anywhere else. A simple, good examination of the oral cavity will tell us if there is any abnormality which could be detected or not. That's it. If the same problem had occurred to the father at 40,
Mm-hmm.
even though he was a smoker, then 40 small cell cancer smoker acceptable, but not at that age. There could be some predisposing factors. Then we could put you on a follow.
Right. 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 Understood. Understood. Thank you so much. I think Dr. John had a couple of questions, so I can just send an email from my team, and probably we can answer his questions in detail because he has a lot
Sure.
of good questions as well. And that brings us to the end of this session. Uh, well, thank you so much, Dr. Kiran. It was such a privilege to listen from you. We had so many questions, and our audiences
Yes.
also, I'm sure, they would speak. And Dr. Geeta for such practical discussion today. The one thing that is striking on mind right now as well, when you talk about the best birthday gift you can ever have is a positive reward. I mean, in a negative reward in that sense, yeah, because that's what also I also completely agree. So thank you, all of you, our audience, for joining us and being part of this important conversation. We hope today's session leaves you better informed, whether that's for yourself, your family, or the work you do every day. Also, we'll be sharing a feedback link shortly. We would love to hear for your thoughts. If you want to reach out to Dr. Kiran, we can just circulate the email IDs and everything, and then probably you can get in touch with him. You will also receive the YouTube link soon so that you can watch the webinar again if you have any doubts, and share it with your friends and colleagues. And we'll be back with another engaging webinar, so stay tuned. Thank you so much, Dr. Kiran, once again, and Dr. Geeta as
Thank you.
well.
It was a pleasure
Yeah,
talking
everybody
about
has a
technology.
wonderful weekend. Yeah,
Thank
Thank you
you.
so
Bye.
much. Thanks,
thank you
Dr.
so
Kiran.
much. Thanks,
Thank you.
everyone.
Thanks.
Thank you,
Thanks. Thank you.
Dr. Geeta. Thank you, Ankit.
Thanks. Bye.
Thank you.
Bye.
Thanks. Bye.
Thanks.
Take care.